first, I would like to apologize to everybody that we are beginning a little bit late, but I promise you that our talk is going to be super interesting. We're going to be covering behavior, we're going to be covering health, we're going to be covering nutrition, and a lot of your questions as well. So that's going to be handled at the end, so make sure that you stick around. So first things first, Happy International Cat Day, right?
Happy International Cat Day.
Yes, I am so happy to be working in this field and where I get to just celebrate cats, play with cats, talk about cats. It's amazing. Do you have anything to say to the viewers today?
I'm a cat mom too, and I absolutely love cats. I treat more cats than dogs. And yeah, it's great that we have a day to celebrate cats.
Absolutely. Okay, so today I am going to start out just super quick before we jump into all the cat stuff. We're just going to talk about who is sitting in front of us right here. Dr. Michelle, I'm going to introduce you and then you can do the same. So Dr. Michelle has been working as a veterinary physician in Mumbai for over 10 years. She completed her pre-vet in Texas and her bachelor's in veterinary science in Mumbai and has a postgraduate diploma from Chennai Veterinary College. She primarily treats cats and believes in a fear-free feline medicine.
Thanks. Amanda Tong is the founder of the Animal Behaviour Academy in India. She graduated from the University of Lincoln with an M.Sc in clinical animal behavior and is trained to work with the behavior of dogs, cats, horses, and rabbits and birds, but now specializes in cat behavior international's first kitty kindergarten and webinar series for cat behavior. She actively works with cat brands, rescuers, feeders, and NGOs to educate people about how to understand and care for their cats better. She believes that animals speak to those who listen.
Okay, so now enough about us. Let's start talking about cats. First things first, we're gonna take you guys through a journey of when you first bring home a little bundle of joy all the way through, your entire journey as a cat parent and pretty much everything that you will need to cover, everything that you will need to know at some point. Dr. Michelle and I are going to be talking today from two different perspectives. One side is obviously the veterinary prism, understanding of each topic, at least to the best of our ability.
Okay.
Cool. All right. So my first question for you is, when you first bring home a kitten, so it's your first little pet, what is the most important thing that you need to do as a cat parent?
So the first thing that you have to do before the kitten comes home is make sure that your house is cat-proofed. This would mean making sure all your windows are secure with cat proofing, or that the grill is narrow enough that your cat can't jump out, because it's a misconception that if a cat jumps from any height, they land on their feet. If it's higher than the second floor, they can seriously injure themselves, and it can also be fatal. From the veterinary perspective, the most important thing is to get your kitten's vaccinations done. Along with vaccinations goes deworming. So for the vaccines, in their first year, you will have 2 tricat vaccines and 1 rabies vaccine. Okay. So you will give the tricat vaccine maybe a few days or a week after they come to you. They have to be 6 to 9 weeks of age for that. 3 weeks later is the tricat booster, and 3 weeks after that is the rabies shot. With the deworming, you have to make sure that you ask whoever you got your kitten from. If it came from a foster or an NGO, find out how many rounds of deworming have been done, when the last one was done. If it's a breeder, similarly ask them that. And the deworming has to be done every 2 weeks till the kitten is 3 months of age. And after that, it's once a month till they are 6 months. Once they cross 6 months, it's every 3 months till they are a year old. And once they cross a year of age, you have to check what their exposure to worms would be. Like, there are different ways that they can catch worms, though they are indoor cats. So just kind of be aware of that and then talk to your vet about how often you need to deworm them.
Right. So that's a lot of homework for the cat parent, to make sure that they're sticking with the schedule.
Yes.
Yeah, absolutely.
Okay. What do you think is the most important thing behaviorally to address as a new cat parent?
Right. So as a behaviorist, when clients come to me with kitten problems, they normally come after the kitten starts to like, so when the kitten first comes home, they're very cute, very fluffy, very small, and normally there are no issues in the beginning. But then as the kitten gets more comfortable around the cat parent, then the little nipping starts, then the little scratching starts, then the kitten starts to chew on your hair. And again, in the start, it's all lot of fun because the kitten's so small and cute. It doesn't hurt. It's not annoying. But then 6 months down the line, you've got a full-fledged adult cat. And then now it's gonna hurt.
Yeah.
So the basic, or rather the one chunk of advice I'd say is nip it in the bud. If this is not a behavior that you would like to see for the next 15 years, you should not be telling or teaching that cat that, hey, it's okay for you to bite my hands or nibble on my ankles. And this is an issue that I see very often because you change your mind later on when you realize that, okay, it's really, really annoying. And the behavior modification part comes in here when you say, okay, you know what? I understand that you as a kitten, you need to bite. You know, you're getting new teeth. You will have to chew or like bite down on something. And that in itself is a very natural behavior. But what you bite down on is something that, you know, I as the cat parent will make sure that, okay, bite the toys.
Yeah.
Bite something else that is appropriate, that is okay for you to continue to bite even for the next 10 years. But if you bite my ankles, then we're going to have a problem. So,
And scratching?
Yeah, same thing. Literally the same thing. So sometimes kittens will climb you. Like if they don't have, like, say, enough objects to climb around. So they'll use you instead as the human cat tree. So you should not encourage that behavior.
Okay.
Cool. Okay. Moving on to the next section here. Now, once you've had your kitten living with you, now, you know, your kitten's become a cat. Okay. Basically, they're a part of your family right now. Now, the difference here that I see between a family member like your cousin, your uncle, your auntie, is that they can talk to you and tell you what's on their mind. Whereas your cat, on the other hand, there's this limited words perhaps that they can use with you. So how would they communicate to you as a cat parent that they're not feeling so well? So what are some common signs?
So cats are really good at masking illness.
Absolutely.
So very often when they come into the vet, they're already really sick.
Yeah.
And we'll tell the client, you know, like, how could you let it get this far?
Yeah.
But the fact is that you will be able to pick up subtle signs at home. So cats, even when they've been at home, say for a month, they will develop a routine. Especially if they're on like commercial pet food and you're like pouring the kibble into the bowl, they'll come running with a lot of gusto. If you find that they're not that excited about coming for their food, that's a red flag. If you have certain times when your cat is taking a nap and, you know, they get up for play and you find they're not getting up so much and they're sleeping a lot more. When you come back from work, if they're still asleep. If they're sitting down but their head is up and their eyes are closed, that's a sign that your cat's feeling a little unwell. Another thing to look out for is the amount that they're grooming themselves, you know. So if they're grooming themselves more and they're getting like bald patches, if they're grooming themselves less and they're looking really dirty and scruffy, if they've got a lot of eye goo, if their ears are looking dirty, those are all signs that, you know, maybe go to your vet.
Yeah. Yeah. I think what really stands out to me when you say all of this is you use the word norm, like the normal. And that can be really subjective because perhaps for my cat walks to me a little bit more like calmly, perhaps. So then that would be my norm. So if my cat's not doing that, then I'm like, have a little red flag saying that something's not all right.
Yeah.
So yes, definitely being very observant about what your cat does on a daily basis so that you know when they're deviating from that.
Simple things like how they're eating their food, the position that they normally adopt.
Absolutely.
Another thing, of course, is the litter box act. If you're cleaning out the litter box and you're finding, oh wait, there's no poop for the last 2 days. Or, you know, if the clumps are really flat, meaning that they've had like a couple of loosies, those are all things to address. So sometimes it's a simple call to the vet if it's just like one vomit or one loose stool. But if you find that your cat has a combination of all these signs.
Absolutely.
So sleeping more, plus maybe losing a little weight, plus puked maybe twice or thrice in the last couple of days. And those are all things that you don't want to just ignore. Because your cat will act maybe that they're not so sick, and then suddenly they'll be really sick.
Yeah.
So
Yeah.
don't wait.
Yes. Excellent advice. Yeah.
Speaking of this, there are behavior signs also, right, that you can pick up in a cat, and looking at the face expressions and so many other things. So can you tell us more about that? Like, how can you tell whether a cat is sick behaviorally?
Yeah, absolutely. So just as you were saying, it's that deviation from the norm. When you are looking at your cat's behavior, you're looking specifically for like behaviors related to play, behaviors related to how they interact with you. So if your cat is more energetic or kind of, engages with you in a certain way, but now is being a bit withdrawn. So all of these signs are like very subtle signs in the beginning, and then you'll notice them gradually getting more intense.
Okay.
So body language wise, perhaps this would be a really good tip for any cat parent out there. There is this free website called the Feline Grimace Scale. .com. And basically that website trains you as a cat parent for free, by the way, and it teaches you how to read small subtle signs like how wide your cat's eyes are when they're sitting, the positioning of their ears, and then you basically mark the cat, like you rate each individual element. And then you know whether or not there's a possibility that your cat is unwell. And I show this video as well to a lot of my clients where a local feeder brought a kitten over in a cardboard box. And when you look at this video of this cat, you wouldn't say that there was anything wrong. But in fact, the kitten had 2 broken hind legs. Like, that's huge, right? And you'd hope that you can see it on the cat's face, that there'll be some element of that. But it's so subtle. And that's why you've got to really train yourself to read those subtle signs. Because we're humans, we're very dramatic. We want loud responses, but your cat's probably not going to give you that.
Yeah, I just want to mention that for a lot of cats who can't leave the house and who are only talking to their vets over the phone, this is so helpful.
Absolutely.
One cat we know about, Michiki, the owners, the parents, they look at the cat, they rate the cat on the Feline Grimace Scale, and then they tell me, I think that she's feeling a little more unwell today.
Yeah.
And it's so much easier for anxious pet parents to identify whether their cat is really sick or not.
Yes, just that little bit of extra validation goes a long way. Yeah. Okay. All right. So that being said, you mentioned something about the appetite kind of going down, as well as the positioning in which the cat eats their food.
Yeah.
Simply talking about the food element, because obviously we are here with Royal Canin, this amazing platform where we get to educate and talk to a lot of you about your cat. So obviously we're going to talk about food.
Yeah.
I'm a foodie. I don't know about you.
A little bit.
Yeah, I'm a big foodie. So we're just going to dive into a small section about food. And I know a lot of you have a ton of questions about what to feed your cat, how to feed it, what is happening when my cat's not eating, and so on and so forth. So we're going to dive into that. But small disclaimer before we begin. Nutrition is a very detailed subject. It plays a big role in your cat's life because you're feeding your cat multiple meals every single day. So it's that consistency that can also, impact your cat over the years.
Yes.
So it's so important to take advice from the right person. Take advice from somebody who's credible enough to answer your questions. Just like human beings, for example, if you had a baby, would you speak to your neighbor and say, "Can I feed my child dal rice all day, every day?" And then your neighbor says, "Yes, of course." So okay. So why would you do that with your cat? So you've got to find the right sources for your information. So that's why we have you with us here. So jumping down to the first question. Okay. So this is a little bit of a trend that I hear quite often. Dry food is really, really bad for your cat. Thoughts?
It's a myth. Okay.
All right.
A lot of people are not going to agree with me because, like you said, it's a trend now. Everyone talks about how kibble is the enemy and kibble is causing renal disease, and it's not. So recently they've debunked the whole idea that dry food is what causes kidney disease in cats. It's not. So when you're talking from an evolution standpoint, cats are raised to be on a minimal hydration sort of diet. So it's not that kibble is the problem. It's one problem is feeding the wrong kind of kibble. As long as you're feeding a good brand and the right stage food for your cat's age, then you're not going to have a problem. And you shouldn't overfeed. So a lot of people free feed. So they'll fill one bowl full of kibble and then leave it out, and then that's it. That can be a problem. So as long as you're feeding kibble in the right amount and balancing it with wet food, you're fine.
Right. And I tell this to my clients as well. You've got a cat, not a cow. You know, you're not just gonna have a cat grazing on the dry food all day, every day. So yeah. Now when you said wet food versus dry food, is it okay to give your cat 100% dry food, 100% wet food? What's your recommendation?
So the ideal recommendation is 70% of wet and 30% of dry.
Okay.
So yeah, that doesn't mean that you base your wet food amount on your dry food. So if you're giving a lot of dry food, like a full bowl, don't give that much more wet food. So say if you're giving 2 pouches a day or 2 sachets a day of wet food, then half a sachet would be the amount of dry food in quantity that you would want to feed your cat. I mean, it's really, really difficult. I find it difficult too. But that is your ideal balance between wet and dry. But also some cats are really fussy and will not eat that much wet. So just make sure that you always have enough fresh water. Change the water often. A water fountain. As long as your cats are drinking enough water, then they'll kind of balance it out themselves.
Right. So that being said, I just had a thought about prescription diets. So just on a basic level, perhaps once your cat has been sterilized, are you supposed to change diets, or is it okay to keep your cat on the food that they've been eating before?
So anyway, once your cat is sterilized, they'll probably be at the age where you're shifting from kitten food to adult food. Right. So if you find that your cat is putting on weight once they are neutered or spayed, then it's a good idea to shift to sterilized. You have sterilized, you have satiety, you have obesity.
Yes.
So different types of dry food depending on how much weight your cat is putting on.
Right.
But if your cat is active enough and you don't find them putting on weight, it's fine to give a regular adult diet.
Okay, makes sense. And the final part here is about if, for example, you're not very happy with the food that you're feeding, or just as I had said about the prescription diets, and you find that you need to change your cat's diet. One thing cats are very famous for is their level of fussiness, of course. So do you have any advice about how you can make that easier?
So it's important to not shift the diet 100%. So don't feed kitten food one day and adult food the next day. You have to make sure that you're mixing the old food with the new food. So you start off with 20% of the new food and 80% of the old dry food, and then gradually increase the amount of the new food that you're feeding over, say, maybe around a week to 10 days until you're at 100% of the new food. So once the kibble is mixed up, they don't really pick out only the old kibble and leave the new kibble. So that's one way to do it.
But I'm sure there will be one cat out there who's watching this podcast who does exactly that. But yes, okay, cool.
And with wet food, it's a little easier. So again, you can start mixing the wet food, or just try giving 1 pouch of the old wet food and 1 pouch of the new wet food maybe, and see how they do with that. But it's really important that some people think that, if I really want my cat to eat this new brand or this new type of dry food or wet food, I will not feed anything else till they eat it. You cannot starve your cat till they eat a particular food, because when a cat doesn't eat for too long, even a couple of days, then they start absorbing the nutrition from their liver, and that can lead to some serious issues. So not more than 24 hours.
Okay, so that's your mark, right?
Yeah.
So yeah, I mean, whenever you're transitioning, of course, you will have some cat parents out there who take on that slight, I'm just gonna make sure you eat it. So I think that time frame of 24 hours is really important.
Yeah.
And that being said, also, there are a lot of cats out there who are very loyal to a brand. They're very loyal to a certain type of taste that they might have gotten used to when they were a kitten. And now this is what they eat. And that reminds me actually of a research paper that came out that said that feral cats, the kittens will only eat the species of mouse that the mother has hunted.
Really?
Like, now imagine how fussy, like, they've just always been. So yes, you will struggle a little bit, but at the end of the day, as long as your cat's getting the right nutrition, you need to work towards that.
Yeah.
Yeah.
Another thing to keep an eye out is if you have more than one cat and you're trying this sort of food experiment, you need to make sure that the right cat is eating, the right food. Speaking of that and having multiple cats, that's something that's really common and really popular, And once you become a cat mom or a cat dad, it's just like, I want to get them all, let me adopt more, let me foster more. But as a vet, I find a couple of problems with this. And I think you would as a behaviorist as well. So there's something that I've heard about called social stress in cats. So can you expand on that a little bit?
Absolutely. So the best way to explain this, I would say, is imagine that you've moved into a new home with a bunch of flatmates who you've never met before. And then you have one flatmate who doesn't pull the flush. The second one who doesn't wash his dishes, and you only have one beanbag in the whole house. Now, that social stress that you would experience living in that home for like years on end is similar to perhaps what your cat might experience when they are living in like a home with other cats that they may not really get along with. Mm-hmm. So the key here is the resources that, like, I had spoken about. So the way that, like, for example, if your cat is eating their food, if your cat is going to the litter box, how is the presence of their, like, counter cats, counter species, how are they impacting that? So, for example, if your cat is eating like their meal and another cat is coming and just staring at them, that in itself is making that meal a stressful situation. Yeah. Or if your cat wants to go to the litter box and you notice that the other cat is just hanging around near the entrance and, staring at him, and then your cat kind of goes off and doesn't go to the toilet at that time. Another example of social stress. So, very, very common with cats, like multi-cat households. So as a cat parent, you need to make sure that you're spacing out your resources. We had spoken about this as well, that, if you have 2 cats, you need to have 3 litter boxes. Yeah. 3 cats, 4 litter boxes. And not in one location, but really spread it out around your house. So yeah, I think these are important points when you have more than one cat.
Yeah.
Okay, so from a vet's perspective as well, social stress, of course, is like you experience it, like you deal with it. I don't know about you, but whenever I am stressed out, like socially, if my friends are just being really annoying, whatever, I sometimes fall sick if it gets really, really bad. And it's like it builds up. I fall sick. Do you think cats are tough enough to take it, or...
They're really tough, but they're not tough enough to take stress.
Okay.
Yeah? So cats are very affected by stress, and I would say that they are more affected by stress than other species, like, say, dogs. So little signs that you will find, like you see your male cat is peeing all over the house, and the cat parent is like, oh, he's just marking his territory. He's not. Okay, that's a sign that they're going into something called cystitis, which is an inflammation of the bladder, which is caused by stress. And that can lead to an infection. It can lead to a blockage and so many other things. So if you find that the litter box activities are a little weird, that's a big thing that's caused by stress. Okay, so that's feline lower urinary tract disease, FLUTD. That's something that's caused by stress, and cystitis, like I said. Another thing that is triggered by stress is something called hyperesthesia. So hyperesthesia is, we're hearing about it more and more than we did maybe a few years ago, after the pandemic also, is triggered by stress. It's a neurological condition in cats, and what they do is they will have an exaggerated response to a small trigger. So the trigger is usually stress, and what they will do is they will self-harm. So you'll find cats who will start with just over-grooming. They'll have like a really bald stomach. They'll create a bald patch on their tail. And eventually they'll start actually biting themselves and creating wounds. And you'll see these little ripples on their back and stuff like that. So those are all signs of hyperesthesia. And that's something that you need to address with a vet. And if you don't address what's causing the stress, it can be something that you will have to treat lifelong. So it's good to address it early.
Absolutely. Yeah. So I mean, I think the biggest takeaway is don't disregard small signs.
Yeah.
Deal with it as soon as you see small hints of it.
Yes.
Especially in a multi-cat household, because there's so much going on at the same time and so many dynamics, shifts and changes that you have to be really vigilant. And that's a thought that you would perhaps have to consider before even getting more cats.
Yes.
Can you be that vigilant to begin with?
Yeah.
So I think you also mentioned about the poo and the pee in the litter box, and that could be like a sign of stress, the way that it's been positioned. So do you have any tips of how do you know which cat is stressed?
So something that you taught me actually is about a little bit of beetroot water in their wet food can help.
Yeah,
it really helps if you have white litter or your regular bentonite
Yes.
clay, because then you can see one cat will have like slightly reddish urine.
Right. So just like a little beetroot cooked with like maybe chicken water, like that stock,
Yeah.
just a few drops.
Yeah.
Makes sense. Okay. All right. So now, stress in a multi-cat home. You can say yes, the cats are play fighting. They are causing the stress. You sit back and you say, okay, it's their problem. But what happens when you're in a single cat home? When perhaps you are the problem. It's the human social side, like that's the cat-human bond that could be stressful. Now, when I think of stress in like a human-cat relationship, the first thing that comes to mind is the process of giving medication. We've got so I want to talk about that right now, because we've got 4 different perspectives for that. We've got obviously the vet side, we've got the behavior side, then we've got the stress coming from the cat parent side, and then the cat is there on the other hand who's also quite stressed out.
Yeah.
So are there any tips you can give or anything that you want to talk about here?
So I think it's important that maybe the first deworming dose you get done at the vet clinic. Have your vet give the cat the first dose, see how it's done, see how they maybe wrap the cat up in a burrito or a towel or whatever and give it to them. And from that itself, you'll kind of gauge whether your cat is more comfortable with tablets or with syrups. And then going forward, if your cat is sick, then you can ask your vet for whatever form of medication you prefer. So if they're giving you a tablet, ask if there's a syrup available instead. If they prefer tablets, ask for that. And if your cat prefers syrups and only tablets are available, ask your vet whether you can crush the tablet and say mix it with honey. Does that affect its absorption? Things like that. If your cat is very difficult when it comes to medication and you know that, you can also ask your vet if, instead of a long course of antibiotics, if you can give like a 1 shot a week sort of thing, So then that's just taken care of when the stressful experience is done with at the clinic. Another thing that you can do from the veterinary perspective is if your cat needs long-term treatment, say for kidney disease or something like that, you can ask your vet to teach you how to give subcute fluids at home. So do it with them at the clinic once, and then you can do it at home with your cat rather than, rushing them to the clinic every single day for months on end.
Absolutely.
But I do think it's possible to train them, right?
Yeah.
So how do you suggest a new cat parent or an old cat parent gets their cat used to medication?
Right. So I love the thing you mentioned about options. First things first. So I want to highlight that, because sometimes when a cat parent goes to the vet and they ask, okay, my cat's not well, what do I do? The vet says do A, B, C, D, E. And the cat parent says, okay. And then they go home and then they have all their problems. So asking the vet while you're at the clinic what other options there are, that's so useful. So once you get home, from a behavior perspective, there are a few things that you can do to make it a little bit less a little bit less stressful. So one of the things are using pill pockets. That's basically a treat that you get on the market, where it's an extremely flavorful concentrate of like chewy kind of substance.
Yeah.
And then you hide the pill in that. Some cats will still be smart enough to separate the two, but normally it's sticky enough for the cat to just kind of swallow it. It should be that easy. Most of the issue with medication is that element of bitterness.
Yeah.
And then the cat thinks that you're poisoning them because you're trying to put something bitter in their mouth. And as an instinct, like you'll get that frothing,
Yeah.
where the cat's trying to kind of take out that poisonous substance from them. So if you are able to add in that element of flavor which masks it as much as possible, whether you're using treats, whether you're using pill pockets, that could always help. Another thing is something, so as you were saying about the training element, there is this method called the Premack principle. So the Premack principle basically states that you follow the thing that you don't like with something that you do like.
Okay.
So eat your vegetables before you go out to play. So in this case, the cat would have the tablet and then get like a really, really tasty treat like directly after that.
Okay.
So then it's not such a bad thing that lingers on. It's like, okay, it's just a short duration and then we like get something nice from it. But I think like holding down your cat or scruffing your cat also just adds to that stress. Whether you've been doing it for multiple years now or whether you start out by scruffing when it perhaps is just not necessary. And a couple of other things that I could think of or that I recommend is that you get these gelatin based like capsules on Amazon, and you basically fill the powder in it, but the external coating is it doesn't have that
taste.
flavor. Exactly. So even if you are, for example, opening your cat's mouth and putting it in, it's not that instant bitter feeling or taste that the cat would get. And then you follow it with treats. So just a few smaller things like this, especially when you're starting out, making sure that you start out on the right foot. Just because everybody else is scruffing their cat and forcing it down their throat doesn't mean that your kitten needs to go through that same thing.
Definitely.
So I think, these are just a few suggestions. I'm sure you guys will have a lot of questions about this as well.
How do you feel about pill poppers? The piston-like thing where you put the capsule at the end and you shoot it in. Is that stressful for the cat or are they okay with
Right. So I think that also comes down to a certain amount of socialization. If you train your cat, when I say train, I mean if you teach your cat that I use this and then you get some treats. I use this and then you get some treats. It's that experience of how you use it.
Yeah.
And you also know that it's not just the gadget, it's how you use it.
Yes.
So same thing goes for the pill book.
Okay.
Yeah. Okay. Now, moving on to the next section, we're going to be talking about teeth. Dental health. Now, this is something that can get overlooked very often because your cat's obviously not smiling at you on a daily basis. So there's less, like you're looking at your cat and you're not seeing their teeth right up front, especially behind and stuff like that. Also, a lot of cats don't like to get handled around the mouth. A lot of cat parents, if they try it, they don't like the consequence of what happens after. So do you have any advice about how to take care of that a little bit better?
So the signs that your cat is having trouble with their teeth, one of the first things is that their breath will get really bad. And I don't mean like the regular, like a wet food sort of smell. It will stink. So even if you have your cats coming and grooming you, a lot of cats do that, and you find that your arm or your hand is smelling after your cat grooms you, that means that their breath is really bad. You'll also see that if they have dental disease and gingivitis, when they're grooming themselves, the saliva itself will be tinged a little brownish or reddish sometimes, and you'll see stains on their fur. That's another sign that they have dental disease. When you're patting them or if they're sleeping, if you could just lift up their gums if they let you. That's a very obvious sign. So it can start with mild gingivitis, which is just a mild red line between the gums and the teeth, which gets darker and darker. And while they're eating dry food or wet food, for some reason I find that a lot of cats will eat the dry food but leave the wet food when they have dental disease, because the wet food tends to stick in the gums and it gets really sore. But they'll just gobble up the dry food and swallow it. So if you see that your cat's not eating their wet food very happily, then that's a sign that something's wrong. Don't wait too long. So people are very scared of anesthesia, a lot of people, but don't be. Very often all this needs is a simple dental scaling. It's just a half-an-hour procedure. Do it with a vet you trust, but do it. Because if you leave it, then it's going to be multiple extractions later on, and it's it's not a pleasant experience for the cat. It's going to be a lot more costly. So it's better to just address it earlier when it's just starting out.
Definitely, yeah. And again, we're back on the same trend of like, don't wait, don't procrastinate it, smaller signs. Yeah. Oh, we got some questions. All right. So we will get to those at the end of the talk. So yeah, if you guys have any more, please drop it in the comment section and we will address them soon.
Okay. So speaking of dental care,
Yeah.
is it possible to train your cat to brush their teeth? And how can you make the whole dental care situation as stress-free as possible?
Right. So, of course, when you said that, I imagined a cat like brushing his own teeth. So, probably not brushing it in that way. But definitely, cats, like feral cats, will take care of their own dental hygiene. Or rather, it's a process that happens when they are chewing down on bones or chewing down on like tougher meat that would perhaps rub against their teeth and gums and clean off any tartar that would be there. So you as a cat parent, you can definitely offer your cats a lot more opportunities to chew down on more natural protein sources. You can look at giving your cats silver wine sticks.
Okay.
So this is basically another form of catnip.
Okay.
But it's basically the branches of this particular like bush or tree called silver vine.
Okay.
And you get it on Amazon or wherever. It's called a matata bee stick. So you give it to your cat and your cat just starts to kind of chew, and that again just helps maintain that. Some other ideas would be putting dental drops in their water. So again, like a non-invasive way of kind of maintaining that health. Of course, if your cat's dental health has gone beyond a certain point, you will have to visit the vet, get everything sorted there, and then look to maintain that health.
Yeah.
And yeah, just overall, you also get those toothpaste which are treat like very heavy flavor based, which you can use. But again, yes, when it comes to training, it is just about teaching your cat that a small amount of exposure or like a small, like my finger in your like mouth on your tooth for 2 seconds leads to like good things. So if you hold your cat down, you open their mouth and you brush all their teeth at the same time, you may get away with it like 5 times, 6 times. But then the 7th time, that's not going to happen. So be patient with it. That's definitely like some advice that I can give. It's going to take that time to train your cat, especially if you're going to begin after they have problems. So start early. Yes. Okay. So, and now we're going to basically talk about the last topic before we jump into the questions. This was a topic we both agreed was really, really important because nobody talks about this. And that is the topic of the senior cat. Okay. So the senior cat, and like you would say, what, 8 years? 10 years?
Yeah.
Okay, right. So 8 years is like approaching the corner. 10 years is where your cat is now like a senior citizen cat, you'd say. Okay. So what advice can you give to the older, more mature cats out there?
So you just have to maybe be a little more patient with them, first of all. They're not going to want to play as much, so you will have to alter the kind of activity you're doing, because as a senior cat, something that you will have to look out for is arthritis. So they'll be a little slower. They may not want to jump as much. They will sleep a little more. So you've got to make sure that that's not going overboard. So they're not sleeping all day. They're not skipping meals because they're sleeping. So keep an eye on things like that. Keep an eye on their water intake. If you find that they're drinking a lot more water and peeing a lot more, then that's a sign of kidney disease. And that's one of the most common things that you will find in a senior cat that they suffer from when they're older. An occasional vomit is okay, but if your senior cat is vomiting maybe multiple times a week, then that's the time to get a blood test done. Anyway, for a senior cat, I would say once a year, get a blood test done. Even if it's a little stressful, maybe have a vet come home or talk to your vet about giving calming medication before you go into the clinic. But yeah, at least you can get a baseline and know how the kidneys and liver is doing, get their heart checked. These are all things you've got to keep an eye out for in a senior cat. And their teeth again. So, just make sure that no teeth have to come out or nothing's irritating them. Yeah, just an annual check, I'd say, for a senior cat.
Right. So just being more vigilant.
Be more vigilant. Be more vigilant and be more patient. just modify how you are with your cat, maybe spend more time with your cat. I mean, they'll suddenly seem like they've aged a lot. They'll be fine from 10 to 13, and then at 15, you'll find them, oh my God, they've slowed down so much and they don't want to eat as much and they're looking so skinny. So don't wait till they're like skin and bones.
Yeah.
Give them as much of a life as you can. But something that we encounter in humans as well, and then in dogs, now we're seeing in cats, like neurological deficits and cognitive defects. And I'd really like you to talk about that, please.
Right. Okay. Right. So in general, older cats will also go through similar symptoms as, like, say, a human being going through arthritis, dementia, Alzheimer's, and it's basically like feline cognitive dysfunction. So that suggests that, like, obviously the cognitive abilities are kind of getting a bit slower. Perhaps, like, you would notice your cat standing in the room and just kind of gazing off in no particular direction, or just wandering about a bit, like, aimlessly, like without like a purpose. Otherwise you'd have a cat walking to a specific spot doing something there, versus a cat just kind of now roaming the house a bit aimlessly. So you may start noticing this, and, like, again, it's a very subtle sign. So there is that tendency to say, oh, he's just looking at the wall, or maybe there's a fly there, or something like that. But if you start noticing this more often, definitely going to the vet and checking and seeing what's going on. Sometimes I also see cats that have memory issues, in the sense that they forget where the litter box is. They forget where their water bowl is. If your cat has perhaps been trained, so if you teach your cat how to sit, how to give a high five, or how to, like, jump on your lap on, like, command, and now you're asking the cat to do those things again, and you're seeing that blank stare back at you, that could suggest that the cat may not even remember, or may be a bit fuzzy with what that command is, or what it is that you expect them to do. So all these smaller signs, your cat's not stupid or suddenly, just acting out. If they've crossed that age, you have to consider the possibility that this could be, the reason for it. Another thing that I find very helpful as your cat gets older is to add in more helpful objects in the house to help them climb.
Yes.
Because as the cat gets older, you may notice more hesitation to jump up, even if it's just like 2 feet. And before, your cat would do it in a second, but now you're seeing that, like, pause. And then when you go to help them, they just jump up because they don't want to be held. So adding in maybe like a memory foam slope, or like a step, or a stool, something that could just kind of help them with that. Because height is so important for cats. And as they get older, imagine not having access to something that is so important to you. It's a big deal. So yeah, I think these are some of the things that would help when you have an older cat. Anything else you can think of?
No, I think that's it.
Oh, wait, 1 second. Slippery floors for when you play with your cat.
When they're older?
Yes. Actually, it doesn't matter whether they're old or not, but if you have marble floors and you're playing with your cat could develop something. If they are running around on a slippery surface and, they're chasing the toy, and then they, like, kind of hit, like, their, like, joints on it or something, you could be, like, basically harming them in that process, and the risk increases when you have an older cat. So I think that's all I can think of for now.
Okay.
Cool. All right. I think it's time to jump into the questions.
Okay. So I'm going to start with a behavioral question. Okay. How do early life experiences and socialization impact a cat's long-term behavior? And what are the most effective interventions for modifying undesirable behaviors?
Fancy words. Okay. So early life experiences, when we're looking at the socialization period, or rather the golden window, you're looking at the time before 16 weeks, and 16 is also really pushing it.
Okay.
But any kitten under that age is extremely influenceable. So anything that happens to that cat in that moment, they will kind of take that experience on a little bit more seriously, because that is the time which teaches them everything that they need to know about life. So if they encounter something in that period and they have a good experience with it, or rather they don't have a bad experience with it, then you're more likely to get a kitten that is okay with that particular trigger. So for example, in our kitty kindergarten classes, when we are teaching the kitten about sounds, we play firecrackers. On a really, really low level first, and then we kind of play with the cat, we feed them treats in the process. So what we do is we link those two things to just be a bit more positive. And then you get like, and we have this like, my adult cats now who've graduated from kitty kindergarten, during Diwali, they are looking out of the window and they're just watching the firecrackers. And that just makes me so happy, because that is like the power of that socialization versus a kitten who has never gone through that and is now an adult cat and hears that first boom, and they're so terrified because they just don't know what it is. So yeah, early life experiences, big deal.
Okay, here's another behavioral one. How will we know our cat is having anxiety?
So fear or anxiety doesn't just manifest in the form of a cat running away, because that's generally what the cartoons tell you. You know, when Tom is really scared, he's running away. But you like, and when you see a cat like run under the sofa when say a guest comes over, you're like, okay, my cat's scared. But there are also other responses to fear. So you have the freeze. So if a cat completely freezes up, and I'm sure you see this a lot in the vet clinic as well, where running away is not an option. So the cat is just frozen still on the table. You have also the fight response. So defensive behaviors are also an indication of fear. The best example would be if a cockroach enters your home. You don't run away, you go to kill it, or you try to at least. So that response of being defensive as well tells you that there is possibly fear. So the freeze, flight, frozen, and fight. So that's your 4 Fs. Tongue twister, but yeah.
Okay, cool. How to ensure a cat is enjoying its meal? I'm not sure if that's... So I've read about how if they're lying down, then that's a sign that they're really enjoying it. That's how you can tell that your cat is enjoying it. But they should be finishing what you're offering them. That's how you know that they're enjoying their food. They will come and ask you for food before their time is due every day. If you want to make sure that your cat is not swallowing their food too quick and relishing it, you can use something called a licky mat or a slow feeder. So it's basically a plate with little, like a puzzle sort of situation, and you just spread the wet food or the dry food into it so that they've got to lick it and take more time finishing it. So you're kind of making sure that they're relishing their food. And yeah, having it on a plate rather than a bowl helps. With dry food, you can also scatter it around sometimes, so they go looking for it and it becomes more of a game. And they take their time eating it. So that's another thing that can help ensure your cat is enjoying its meal. Okay, what enrichment activities can I offer to keep my cat mentally stimulated?
Right. So just building actually off what you said, where you're using your dry food to scatter it. So instead of perhaps taking like a whole handful of dry food and just throwing it, that is one, like that's a great way to do a scavenger hunt. But sometimes you can really tap into the cat's hunting instinct by taking a single piece and then sliding that. So it's like a single focus of, oh my God, what is that small thing that's running away that I can go and chase? Overall, enrichment doesn't only have to come from toys. You can incorporate that into other elements. So lemongrass. Sorry. Sorry. Yeah, so you can use lemongrass as well to like play with your cat like a feather toy. So using other elements in your home to play with them, not just their regular toys, makes it more enriching. Changing the environment in which they play also makes a big difference. You can use food puzzles, but the best way to introduce a cat to food puzzles would be to use DIY objects like an egg carton or a cardboard box or something.
Okay, cool. Okay, at what month should we give a deworming and vaccine for a kitten? So we talked about this already. At 6 to 8 weeks would be the perfect time to start. And the vaccines have to be repeated every 3 weeks. That's 3 vaccines in total for your kitten. And the deworming is every 2 weeks till they are 2 months old. Okay, there's the next question. My male cat recently had a UTI and he was advised by the vet to give him wet diet, but he is not liking the wet food. Any help, please? You've just got to be more patient. You can try different flavors of the wet food. Try mixing the wet food with a little bit of the dry food that they like on top of it. If they're not, then ask your vet about getting a prescription urinary diet that takes care of more urinary issues than wet food does. So it's not necessarily just wet food that helps. Okay. What supplement is good for fur for a kitten? So I think that if you're giving good quality dry food and wet food, you don't really need to give a lot of supplements or any supplements at all. But anything that contains salmon oil, if you have a Persian cat, would be good. Or else you get a whatever brand that you're feeding, make sure that it's like the Persian variety or long head variety, and that should be good enough for the long fur. Okay, how to distinguish a male or a female cat? You want to take this?
Please.
So it's fairly easy even for a little kitten. You just lift the tail up and you have to make sure that there's a gap between both the openings that's large enough for the testicles to come in later. That's how you know it's a male. If both the openings are really close together, then it's a female. It's that simple. Okay, reasons for a urinary tract infection. One of the biggest reasons is stress. Another reason is not keeping enough fresh water out for your cat. If it's an indoor-outdoor cat, then they can catch UTIs just by mixing with other cats or, peeing on surfaces that are not clean enough. And once they lower themselves, they can catch a UTI. But the most common reasons are stress, in males especially. If it's a female who's getting a UTI, she may not be spayed, so that can be causing it. Poor quality dry food can also lead to urinary issues. So, especially for people who are feeding a lot of strays, they will go for the cheapest brand possible. But remember, the amount that you'll be spending on vet fees later is so much more. So it just makes sense to go for a good quality dry food instead. Okay, I have a Persian cat and there are tears coming from one eye all the time. Is it normal? No. I think you'll have to get that checked. It can sometimes be a blocked tear duct, which is fairly common in Persians. So you need to get that checked by an eye vet specifically if possible. Okay, sorry, these are all medical questions.
Please, I'm very happy to listen.
There are reasons for hair loss and hairball in stomach. This is one reason could be that you are for a hairball in the stomach is that you're not grooming your cat enough. It's very important to groom them every single day. Use maybe 2 kinds of brushes if it's a long haired cat. Another thing that you can use is a hairball gel, or make sure you're giving a diet that is for long haired cats or hairball control. And if there's hair loss, then that can either be because of stress, so they tend to overgroom and then they will lose hair in patches, or you need to get this checked by a vet if it's hair loss, because it could be mites, it could be a fungal infection, it could be fleas. There's so many things that could cause hair loss, but yeah, you need to get that checked. Okay, medication and diet for balanced diet food. I'm not sure what kind of medication. Maybe they can message us later, but for each age, there's a particular food that you would feed. So I think stick to kitten food for kittens and adult food for adults. If your cat is gaining weight, then you can go to either a weight management diet or a satiety diet or a neutered cat diet. That should be good enough. As they are carnivorous, how to maintain their meals? Same thing. So when you say that cats are obligate carnivores, that doesn't mean that they need to eat meat at every single meal. It just means that they need to get enough protein. So if you are feeding commercial food, all your commercial food will have enough protein and will have enough of the supplements that they need, which is taurine and your amino acids and everything else. So that kind of takes care of their meals. You don't need to add a lot of vegetarian stuff in your cat food. So a little bit of pumpkin for fiber is fine, but try and not give them too many fillers if you're giving them home food. Okay, how do you deal with cat acne in a senior cat? One way is to just wash their face a little bit. So you can use a very dilute chlorhexidine sort of wash. So that's a little bit of Savlon and water and just wash it. Otherwise, you can use a very mild antibiotic ointment like Fusidin or a cat shampoo. It's normally just on their chin. So it's fairly easy to deal with. Oh, a behavioral one. Yay.
No, this is what happened in our last behavior talk as well. It was just the behaviorist and all these medical questions. So I'm really happy that you're here. So you just can address them all without me saying, go to the vet, go to the vet.
What is the posture of a cat when it's enjoying its meal?
I mean, yeah, you answered this. Like you said that if the cat is bent down a bit more, that suggests that they're enjoying their meal. And of course, not just the position, but whether they finish it or not, whether they're excited to eat or not. So, yes.
Okay. My cat is pregnant. Is it safe to deworm her? It's safe in the first month, but talk to your vet about what deworming you can use. But yeah, first month is safe. There's no rush to deworm a pregnant cat, so you can deworm them once the babies are out. Okay, and the last question is, we are vegetarian. Can we keep our cats on veg meals? No. Sorry. I mean, you do get some vegan dry foods, but I really wouldn't recommend it. Even if you are vegetarian, your cat needs to have a lot of protein and they need their meat in whatever form. Okay. Any more questions? That's it. Cool.
All right. So thank you so much to everyone who has stuck around until the very end. Thank you so much, Dr. Michelle. And of course, a big, big, big thank you to Royal Canin for providing this platform where we can just talk to you and just talk about cats. It was such a fun hour, I think, for me.
Yeah.
But yes, thank you so